It's just about the last video I ever thought I'd make. I can say I always vote, and I vote based on policy, not party. They're not hockey teams. They're people that you vote for to work for you. I feel it's my duty to vote. It's my only voice in politics, and I do so to respect those who fought and died to give me that voice. Ontario is opening the doors to privatized health care this year. It's happening right across our land. Sure, if you can afford it out of pocket and wish to pay for a private clinic visit, fill your boots. You should have that option if you want it. But not being funded with our tax dollars. I really feel that this is the thin end of the wedge in a process to drive tax dollars out of the public health care where they belong funding that care and into the pockets of corporations as profits. Ontario, for that matter all the provinces, have been starving public health care systems of money specifically earmarked to support those services. Now these governments are telling us that the only way to save the system is to offload patient care into these private clinics. Their way of solving a problem that they themselves created with money already allotted for the public system. These are clinics where we can receive the minimum standard health care or opt to pay extra over and above our provincial coverage. Provincial coverage which is being reduced in what it covers at alarming rates. We may also have to pay out-of-pocket expenses demanded by these clinics in order to receive the treatment or receive it in a timely manner. All of this is bad enough in itself, but corporations are now charging for doctor consultations, obeying the letter, if not the spirit of the law, by arranging consults with doctors out of our province. You can pay to join their group, and after that, your access is free. After you pay. It ain't free. I'm already hearing ads for some of these clinics, and they're expensive ads. We all know how pro-business Mr. Ford is. I'm speculating, but I see in the not-too-distant future insurance companies offering policies to cover those expenses in return for a premium. And I've heard rumblings in the media that I may not be too far off the mark. We're going to wind up with American-style healthcare in Canada, and it will go full bore, and it will go at a blinding rate. I really don't think anyone could say I was being Chicken Little-ish about this. We will wind up with insurance companies in the mix. Ask anyone who's dealt with healthcare in the U.S. what they think of their system. True, most Americans do have health insurance provided as an employee benefit, but the out-of-pocket deductibles are crippling, even with good insurance. Previously in Ontario, you would get your diagnosis, and you and your doctor, using their expertise, would draft a plan of attack based on what was best for you, the patient. Adding a medical insurance corporation to the mix will mean that you will get your diagnosis, you and your doctor will draft that plan, and present it to an insurance company. They may take weeks or even months to have their team of doctors who they pay evaluate the plan and decide how much, if any, they will cover. Your doctor, if they're a good one, will then have to waste their time advocating or disputing treatment options with the insurer. You may even need to bring in legal help at your own expense. They will boil your life down to statistics. Your quality of life to statistics. How'd you like to be written off like an old car? They're happy to take your money. They're expert at not paying it out and shoveling it as dividends into the pockets of shareholders. Think about auto insurance, especially if you had to deal with it from an accident, and not to mention the rates. Nor do these corporations particularly care if they break any rules that regulate them. The fines are paltry compared to the profits that they reap. It's simply a cost of doing business. They get caught, they pay the fine, promise to never do it again, and find a different rule to break. It's profit at any cost. I imagine here in Ontario you could still pay out of your own pocket for anything they won't cover, but you're not going to get it with your OHIP card like Mr. Ford has promised. We already know what his promises are worth. Reed Belt. Excuse me. These clinics have existed here for some time, and those who use them have paid for the privilege. These are businesses designed to make a profit. Once Mr. Ford dumps public patients into them, who's paying for that profit margin? And with what money? Will they ask Mr. Ford for a 30, 50, 70% margin over and above what is paid to the public sector for the same service? These are our tax dollars, and they were collected to fund our health care. I hate conspiracy theories. We've seen so many of them drummed up in the last couple of years, curiously enough, by right-wing thinkers. Many of them. I wonder if these were just to blind us all to a real conspiracy when it was coming down the pipe. I don't have the resources or the time or the education to do a deep dive into following the money. But I do suspect a great deal of it is flowing from U.S.-based medical insurance industry into pockets on this side of the border. Makes sense to some. I wonder if big medicine is in the U.S. is taking a page out of the CIA playbook. There's no shortage of useful idiots up here to fund. Freedom Convoy. Pardon me. Use your voice now before it's taken away from you. And he'll try. He's trying it with Bill 124 again. Doctors and nurses here are talking about what a problem the Ford government's solution will pose. It's a bit of a slippery slope for the feds to step in because of appearing to overreach. And they don't want to set off the far-right base that Mr. Ford has so quietly aligned himself to. Look at how the for-profit care homes in Ontario dealt with COVID and that supposed iron ring that Doug promised to put around them. The conditions were bad before COVID. Remember how bad they got. They had to call in the military in some cases. Soldiers who've seen some stuff in their travels. They were getting PTSD rather, from working in those homes and in those conditions. I can tell you that the dividends were still being paid. Guarantee it. Sad fact I hate to point out is that everybody's going to need some level of care if you live long enough. Medical or supportive care. An accident or an illness change your life in a heartbeat. Absolute heartbeat. It doesn't care what your plan for your life was. It really doesn't. Thanks for staying this long. Here's the obligatory request to like and subscribe if you find any value in the video. Get it seen by more people, and it'll really help the channel. I do have some suggestions on how to slow or halt the situation I've described above. First, register your displeasure at the ballot box with your local member of parliament, federal and provincial. You have to vote. You have to vote. And vote for your own interest and the policies that benefit you. As I said before, they're not hockey teams. there's no undying love for them. We elect them to work for us. Cheer for the one that does the most for you. Ms. Wynne learned a hard lesson when she cheated Ontario. It got Doug elected, and it's a lesson that I think Mr. Ford has forgotten. Support any actions being taken in opposition to these changes. Ford did back down on Bill 124 from Labour, so he can be influenced. And I think that's probably the size of the club we're going to have to use. Anywhere in Ontario, get out, participate if you can. Protest MPs' offices, drugstores, town halls, local overpasses, Loblaw stores. If a strike is called, answer that call. The only way to get a message through to these folks is to hit them in the wallets. The Raptors shut down an entire city for much less of a reason. Seniors, if you can't march or stand in the cold, take a nice little drive downtown. See the sights. Time to appreciate the wonderful province that Mr. Ford's trying to ruin. Not a slow roll or obstruction. We're not members of a clown parade. Just more volume to deal with. Slow things down. Ontario is Ford's to discover. We're not open for private health care. And it's time you do that. We may only get one shot at stopping this. Our children and our grandchildren are going to pay a very steep price if we don't stop it. Thanks for listening.